Help, I'm on fire. You'll understand that.
I'm on fire.
You'll understand that in a minute. Yeah. I'm on F.H.I.R. I'm on fire. What's our current event today we want to talk about?
I want to talk about Microsoft Cloud for Healthcare, and they put this on their blog, Unlocking the Power of Health Data for Better Care. And one of the things that they are worried about, and that, of course, if there's a problem, Microsoft wants to be able to solve it, is healthcare providers have faced unprecedented workloads institutionally and individually. And it's not just here in the United States, they're looking around the world, especially with the pandemic response and how it's creating these seismic shifts in how care is being provided. And not just short-term care, with hospitals being overloaded or worried, but they're looking at the long-term care and how care is going to be shifted when you bring data involved into it, what it's going to look like. Like now you can do a Zoom.
Yeah.
Or like you went in previous episode, you talked about all the data points when you went just to see
when I went
a doctor.
When I went into a provider. Yeah.
And the guy that wrote this blog, he works at Microsoft. He's also a physician. And he had talked about seeing firsthand the challenges of not having the right data at the right time in the right format to make informed, shared decisions with his patients.
Okay. And so when they talk about format, there's a thing called F.H.I.R. It's a healthcare format codex that
fast healthcare interoperability resources.
Right. So what they're trying to do is they're trying to institute a format that healthcare systems all over the United States and all over the world can adopt. So that when healthcare information, which is important because the faster you can figure something out, there's a higher probability that somebody lives.
Yes.
So if we can transmit this information and just ingest it in systems and they can all read the same sort of format, that's a big plus. So everyone's been trying to push this FHIR system. It's called an HL7 format. So what they're saying is that Microsoft is using their online platform to almost, because of its efficiencies of Azure, their cloud processing, that if they can continue to push the FHIR standard, that there will be tangible benefits that will come back to the hospital, the doctor, and the patient.
Right.
That's essentially what they're speaking to.
And their business model is to establish trusted partners and then create those solutions. But the trusted partners is the huge.
The thing is, this is not creating a solution.
Right.
FHIR was already instituted. People just don't want to adopt it because it's a hassle. And also, they're not incentivized to adopt it across disparate systems. But with TARTLE, it's a little different. Your healthcare information in TARTLE is an F.H.I.R. HL7 format. Okay. And it spoke to this article about having the ability for the patient to be also to read it.
Yes.
So when you when you pull down your healthcare data in TARTLE, we keep it in the system in that beautiful format that's easy for other people to understand. We hope that the world will adopt because there's efficiencies to it. But you as the person have to be able to read that.
Yes.
You don't want to go through and read all this XML text and it's like, that is a mess. This isn't even readable. The
problem that they're facing, we'll talk about it later when you're talking about unreadability, is the scribe notes that physicians are putting in there. Because a lot of physicians are getting scribes and then having them, and then they're just typing really fast, and machine learning can't understand that.
Yeah, so here's how this is going to work. So as it's ingested into TARTLE's marketplace, okay, you have your record there. We're going to put this sort of document reading lens. So to you, you're going to see this nice, clean, separated document with all of its categories, even the doctor's notes.
Yes.
That are going to be the entirety of your healthcare record, right? But on the back end, when someone goes to purchase it, if you choose to sell it, they're purchasing it in the F.H.I.R. HL7 format. So now people all over the globe, even here in the United States, are incentivized to adopt the FHIR system more so than partnering with Microsoft, which is probably costs gobs of money. Right?
Yeah, they've even changed the name. It's Microsoft Cloud for Healthcare.
Yeah, it's right. So we're doing this just for healthcare.
Right.
TARTLE's doing it for humanity. Okay. So, and what happens is now that an individual can become financially empowered by controlling their healthcare data, they can share it in this readily adoptable format that is trying to be pushed. Now there's an incentive for healthcare networks, researchers, biopharma, all these people to actually start to be like, you know what? It's time we transition. The availability of information sits here in the TARTLE marketplace with all 240 million Americans, if they want to sell their healthcare information, and it's going to be in this format. I think it now makes sense for us to do this because now we can get access to that data.
Yes. And one of the things that their hopes for that is to enhance patient engagement, empower health team collaboration, and improve clinical and operational insights. So I want to talk about enhanced patient engagement with TARTLE, because I think this is really important, how you would be able to engage.
So what they want to do is they want to set up, easily programmed kind of surveys, or you touch a tablet when you're in the doctor's office. How did the visit make you feel? It's sort of like a net promoter score.
Yes.
And the system will process it quickly, and it will take that customer engagement, whatever it might be, and it will give those ratings back to the hospital. And then the hospital will be like, oh, look, we're doing fantastic. The room was clean. The person felt good about their visit. They are, albeit, sick and dying, but, they feel pretty good. So then we can apply our customer survey statistics against what our financial information is saying. Can we request more money? Well, I don't know. Do people like coming to your hospital? Are you actually saving their lives? And what Microsoft wants to do is they want to be able to process all that thing in-house on one server. So there's so many people that attack the healthcare industry. They're coming in there, I got the next best idea because there's so much money, there's so much availability in it, right? There's so many resources. They're like, well, I'll sell you my healthcare system to come in and, talk about patients and how they feel and follow up with them, yada, yada, yada. Well, Microsoft's saying we can do all this in-house on our cloud servers for our Microsoft for Health program. Yeah,
and one of the things is with the reason that they're saying the word Microsoft Cloud for healthcare is they want to shift from on-premises computing to the cloud in healthcare.
Yeah, because there's certain efficiencies with that. But then, for the people that are at the hospitals, they're used to having things in-house. They're used to owning their own servers because the liability sits a little differently. Rather than saying, okay, we're going to pass off all the management liability over to Microsoft. They can take care of it. And so somebody in whoever's the chief of security or information, whatever, security, information security at the hospital would have to make that decision. Is it worth us to actually make a transition from in-house servers to a fully uptime 99.99% operability with Microsoft?
Because
Cloud?
What people don't realize is a lot of it, whether it's this hospital brand or that, corporation or that one, they each have their own separate systems and they're not communicating with each other. If you go to, like here in Albuquerque, if you go to Loveless and then you go to Presbyterian, they can't read that information.
They don't talk to one another.
No.
They're 500 feet apart.
Yes.
And so Microsoft thinks that, well, if we can pull one individual in, then we can say, okay, guess what? We already have one healthcare system. I know they're in your network.
Right.
So if we pull you in two, look at the efficiencies between you two speaking to one another. That's all they're really saying is they're taking disparate sources and bringing them together and creating a pipe that essentially is a new telephone system for them to talk.
Yeah, and one of the things that they implemented, which I thought was interesting, was they call it the Microsoft Health Bot. You're laughing, bro. And so it was an AI-powered virtual health assistant. During COVID, it got 600.
Sorry, that's glass on the mic.
Oh, yeah, glass on the mic with your kombucha.
Yeah.
They got 600 million messages and deployed 2,300 COVID-19 bots in 25 countries. And that bot ended up serving 50 million users. And what it was able to do, especially with the U.S. Center for Disease Control, was to communicate up-to-date guidance, prioritize care for the most urgent patients, and then receive real-time data on people's interaction with the bot.
Sure.
And so that bot, we look at that and they're considering this to be something revolutionary in healthcare. But that real-time data with TARTLE, that's what I want you to talk about, because that ability to be able to go directly to the customer.
Yeah. So
or patient or whatever.
They had to go through the hassle of redesigning this bot.
Right.
And then pushing it out to subsystems and then educating the people in that health network to tell their patients that this bot is available.
Right.
It's like, I don't know, 20 degrees of separation from the guy that actually wrote the code for the chat bot. So why don't we just skip that cut to the chase? Why don't we go to TARTLE? We ask the people what their IoT data is. We ask them for their healthcare information. We ask them for their genome record. And then we ask them for their behaviors. Hey, have you traveled? Where have you gone? You can do it right to that person directly, instantly. No redesigning, nothing.
Right.
No chatbot had to be written.
Yes.
And you can buy all this information in bulk from any country across the globe in any locale. What's simpler?
I know that. Yeah. Exactly.
I'm going to write my chatbot in my Azure cloud. Right. No, I'm not trying to bash Microsoft, but I'm just talking about simplicity of approach.
Yes.
If you're trying to solve a problem, go to the source.
Right.
Don't create a new tool that you can sell and then resell again and then get people to adopt after you've made your money.
Yeah, exactly. Yeah. I mean, that's basically what's happening. So there was recently released in open source, the medical imaging server for DICOM, they call it, DICOM. And so it's ingesting medical imaging data in the cloud. And, one of the things that it's working alongside, they want it to work alongside Azure, APIs, and also for F.H.I.R. But whenever you look at something like this, it's medical imaging server for DICOM, and it's open source. Whenever and you're seeing AIs being built in open source and stuff like that, that gives the ability for us to, and anybody that's a programmer, to be able to take this information, disseminate it, and then build upon it.
Yeah, that's the thing that's amazing.
Yes.
I love hearing about this open source stuff because there's not a profit incentive first.
Right.
And the fact that somebody can come in with fresh eyes,
right,
and put in a new type of, algorithm that analyzes all this imagery differently can probably find something that otherwise the medical industry didn't even know to look for.
Right.
Right. Because you always need that outside perspective, especially when people are coming in to analyze certain things.
Yes.
Or program, some sort of machine learning algorithm. It can't just be the specialists. They're not well-rounded enough because when you over-specialize, you breed in certain weaknesses.
Yes.
So you have to get other sets of eyes. And that's the beauty of that sort of open source system that they have in place. That's why, Microsoft bought GitHub.
Mm-hmm.
This massive open source community with all this code. Obviously, they would want to get their hands on it, right?
Yeah. No. And then also, any of these incubators or test beds but because I always like to simplify things, that, Alex. So when I think it's very important. So now we have a problem. We have people buying canine dogs, and they're having to be Belgian Malinoses now and not German Shepherds because the overbreeding of German Shepherds.
It's weakened the hips and the back.
Yeah, and now it's sad because we go to the dog park and you can see, German Shepherds, their back legs and they're so crouched down low and they're being able to walk,
Yeah.
And that is so specialized. And trying to create something, that nature begins to go against.
Yeah, it breaks down at that point.
Yes.
So those weaknesses come in play. And what's interesting about the DICOM is that that's information that has been allowed to be shared.
Yes.
Okay. Those people can go to TARTLE and purchase all the imagery they want.
Right.
As much as their imagination could ever dream up.
Right.
And then they can take that and analyze it, and it's a whole new bed. And with that comes all the identifiable markers that are truly important.
Right.
So not only have I identified a bunch of sick people's x-rays, right, or CAT scans or MRIs, whatever they might be, I actually know the person's that's sick now. I can actually go to them directly and give them instantaneous help.
Right.
Rather than just saying, I took an aggregate of photos from all the healthcare systems and I brought them all together and I analyzed them anonymously. And now I can figure out how, tumors grow better. It's like, well, that's all well and good.
Right.
But let's talk to the person directly to keep them alive.
Yes.
And that's a function of going to the source.
So one of the problems that they're facing is healthcare data and the way that it's formed. One is you have unstructured text, such as doctor's notes. You have medical publications. You have electronic health records. You have clinical trial protocols. And then you have medical encounter transcripts.
Yeah.
And there's, more than that. But those are, so it's like, so now we're receiving all these data points from all these different, and we have all this text, all these different types of forms, and trying to make sense of it all. If you see.
This is where I see the future headed. So F.H.I.R tries to take all those different pieces of the medical system.
Right.
Where data is being collected at all those points and put it in a nice record format.
Right.
Text is a very difficult thing to go through. But I can say probably with almost 100% of surety right now that the future will be a function of transcription of audio.
Mm.
There'll be microphones in all the rooms. It'll listen to everything. It'll transcribe all documents, all conversations. It'll be able to separate out speaker from speaker, even if there's 30 people in the room talking at once.
Right.
Because it can analyze the wave patterns. And it will be able to take that and put it into text, a readable format after it's been spoken, and automatically catalog it.
Right.
That's where the future's headed.
Yeah, and I think to close, and you can speak to this to oversimplify it. Whenever you look at like Picasso paintings, it's cool to get 50 of them and protect them and put them in a sheet and store them in a perfect environment.
Yeah,
and put them somewhere. It's cool to collect all this raw data, but when it's really appreciated, it's when it's put out.
Yeah.
To
when you put
that audience.
When it's in the impression exhibit at the Philadelphia Museum of Art or the Louvre.
Then it has an opportunity. It has an opportunity not only to be expressed to the public, but it has an opportunity to be valued and shared.
Right. And that metaphor
yes.
is exactly what TARTLE is doing in its architecture for how that information is shared, moved, and that value is actually received.
I love that.
Cool deal. Thanks, everybody.
Yep.